All right, let me just, okay, I'm recording. All right, let me present some stuff that that I might ask about on the exam. So you're going to add this to your questions on the lymphatic system and immunity. Those ones we went over in the last lecture. So go through here a little bit. This is anatomy. I tend not to ask about anatomy. Okay, so here, alveolar cells, we're talking about the alveolus. So this is the end of the respiratory tract. You know, it branches from the trachea. It goes into bronchi, primary, secondary, tertiary. Then it branches even further and further. And then at the end of it all, at the end of the terminal bronchioles, you end up with the alveoli, right? Or these are like alveolar sacs, right? And so there's different types of cells in here, type 1 and type 2. And that's what this next slide is getting at. Type 2 are septal cells, and they produce surfactant. So that's something that I would like you to know. And so, yeah, we have to lower the surface tension, just like I wrote here, in the alveoli, because the walls of the alveoli, you need to keep them moist, but in keeping them moist, you're creating a barrier. So oxygen needs to bust past that barrier of water, right? Water has a high surface tension. So you have to get past that, got to get past that water so that the oxygen can move into the blood. And this is the whole issue with premature births. You know, that's, if they're going to stay in the hospital, that's usually why. It's that they'll say that their lungs aren't developed. Well, what it is specifically is that they're not producing surfactant yet. So they're breathing in oxygen. The oxygen can't get past that layer of water to move from the alveoli into the blood. So I'd like to know about septal cells and what surfactant is. I'd like you to know that the respiratory membrane is, so the respiratory membrane, if we're looking at this photo here, and then you kind of focus in a little closer, right? So we're right here, they're kind of marking it here in between the, this is a capillary, here's another pulmonary capillary, right? And there's like the blood cell. So we're really talking about the lining of the blood vessel, and the lining of anything in your body is going to be epithelial cells. So here they're going to call it the endothelium, because that's what we call epithelial cells in the blood. So you can already see it over on the next slide. So it's the epithelial cell of the alveolus. Epithelial cells are often, very often, attached to a basement membrane. So it's the epithelial cell of the alveoli, attached to the basement membrane, and the basement membrane of the capillary, and then the endothelial cells of the capillary. That's it. That's where, so that's what oxygen has to cross through to get into the blood. That's what carbon dioxide has to cross through to get into the alveolus. You definitely know these three laws. So these three laws, you already know Boyle's law. We've talked about it when we've talked about blood pressure. So when you have vasoconstriction, the blood vessel becomes smaller, pressure goes up. Vasodilation, vessel becomes larger, pressure goes down. That's Boyle's law. Inverse relationship between volume and pressure. Right? As volume goes down, pressure goes up. But that is what's behind breathing. So we'll get to that in a second. So I want you to know what Boyle's law is. I want you to know what Dalton's law is, right? It doesn't matter how much carbon dioxide is available. The pressure of carbon dioxide is independent from the pressure of oxygen, and vice versa. Every gas. So this air around us, for example, is about 78% nitrogen about 19–20% oxygen, and then the rest of it is like carbon dioxide and some water. It doesn't matter what the pressure of nitrogen is. That's independent of the pressure of oxygen or the pressure of carbon dioxide. Gas has its own independent pressure. The most difficult law for you to remember is Henry's law. So as you're looking at it, they're saying the amount of gas that dissolves in a liquid. So we're talking about what gas? Oxygen or carbon dioxide, but we're talking about oxygen here. The liquid blood. So how much oxygen is going to get carried in the blood? It depends. How soluble is the blood, and what's the pressure of the oxygen? Obviously, if the pressure is more, then more of it's going to end up in the blood. That's why you give oxygen to people that have like a low O2 sat. So we're going to get back to each of these three laws, but in general, I want you to know these all three laws. Then, what causes us to breathe in? I'd like you to be able to explain it, in a narrative form. So, if you're going to just copy down this slide here on the test, then I'm going to take off points because I want you to understand it and be able to explain it. So it's passive, meaning that, it's active, meaning that it needs energy. So there's a muscle working here. It's the diaphragm. Well, there's two muscles. Diaphragm, that's the main muscle. And then you have muscles in your ribs called the external intercostals. So that's going to lift the rib cage. Both of those things, when the diaphragm flattens down, the lungs get larger. That gives more room in the thorax. And when the rib cage lifts up, I think one of the slides you saw like a bucket handle. So you think of the handle of the bucket just lying at the side of the bucket, right? And then when you lift the handle, there's like more room underneath it. So the rib cage lifting up, that gives more room in the thorax. The diaphragm flattening, contracting, that gives more room in the thorax. Lungs get larger. What happens to the pressure? Think of Boyle's law. When the lungs get larger, the pressure goes down. The pressure of the lungs goes down to a point that's lower than this ambient air around us. So the air from outside goes into our lungs. We're not sucking in air. It's more like the air that's outside wants to go into our lungs. And that's how we breathe in. Right? So most of it's diaphragm, but some of it is the external intercostals. So remember this, external intercostals for inhalation, internal intercostals for exhalation. But most of exhalation, most of breathing out is elastic recoil. So when your lungs get larger, there's some elasticity to your lungs and it goes back and that pushes the air out, right? There is other things. I'm mentioning here your internal intercostals. Look, for the test, just know the main one, right? Elastic recoil. That's what's causing us to breathe out for the most part. Because breathing out is passive. It doesn't require any energy. So if you see people trying to breathe out under like a normal circumstance, something's wrong, right? And so you'll see their lips like that, right? Pursed lips. They're in, that's not normal. Breathing out is supposed to just happen. So I want you to know why we breathe in, why we breathe out. Breathing out is easy. Elastic recoil, that solves your problem, right? You could just say your lungs are elastic. That'll mean something later on because people that have advanced COPD, one of the things that happen is their lungs lose the elasticity. So it doesn't just snap back. Right now, you got to push the air out. You've got to do something that should have been just happening. And there's the bucket handle thing. So Question so far, why do we breathe in? Definitely the laws. Which law pertains to why do we breathe in? Boyle's law. What's the respiratory membrane? It's a smaller question. And then what are describe the what are septal cells? I don't know. Probably gonna ask about that, but I might. It's a small question. Okay, this one. I've got it on the next slide. All right, so that one might be confusing to you. This is see these like this red line here, up, down, up, down. It's tidal volume, just like the tide goes in and out. That's just your normal breathing. I definitely want you to know that tidal volume. Tidal volume is about half a liter, or in other words, 500 milliliters. Definitely important. You should know what tidal volume is. So just your normal breath is about 500 milliliters. And so, you know, when we look at that, we don't want to look at just one breath, right? So you tend to take that over a minute, and so that's why I have this minute ventilation, right? So take tidal volume times breaths per minute. We breathe about, it varies, 12 to 20 breaths per minute. So, you know, if we're going to say 16 breaths, and each breath is 500 milliliters, then your tidal volume is going to be like 8 liters, right? So anyway, that's just enough. Look, I tell you, I don't really care about you knowing numbers and stuff. Tidal volume, I'd like you to know that. I don't really care about minute ventilation, like knowing a number. I just want you to know it's tidal volume times a minute. And then I also want you to know that, you know, every time you breathe in, not all of that air, that ambient air, makes it to your blood, right? Some of it's going to be stuck in your trachea and bronchi, and we call that dead space. So about 500 mils is tidal volume, but really out of that 500 milliliters of breath in, only about 350 milliliters is actually going to reach your blood. But anyway, the number here that I want you to know is 500. I want you to know that alveolar ventilation rate is the amount of oxygen that's actually reaching your blood, right? Because only 70% of that reaches your blood. All right, so where are we with these other numbers? This is showing you here. This is, I don't know if I'm going to ask about it, but just know inspiratory reserve, expiratory reserve. It's not difficult. You take a normal breath and then breathe in as much as you can after that. So when you breathe in normal, that's tidal volume. You're breathing in 500 milliliters. How much can you, like, what's the maximum you can get in after that, right? So I don't care about the number really. Just for your information, it's, you know, it's around 3 more liters. So it's like another 6 times amount of air. So you can get a lot in there. Expiratory reserve, that's more of a common thing that they'll do. Pulmonologists will have you breathe out and then just push all the air out you can. Right? And so you're seeing that you're not pushing everything out. You know, you still have some air, residual air left in your lungs, because you're not going to collapse your own lungs by breathing everything out. You're not going to deflate them. Right? Anyway, expiratory reserve, how much can you breathe out? Like the maximum amount you can breathe out. Inspiratory reserve, the maximum amount you can breathe in. I don't care about the number. Just tidal volume. I want you to have an idea here. This is Dalton's. I don't have a slide on it, but this is Dalton's law. Dalton's law is about talking about each gas exerts its own pressure. Here, the two gases we're really talking about are oxygen and carbon dioxide. So they have pressures, just like blood pressure. It's the same thing, millimeters of mercury, right? So your oxygenated blood has a certain amount of oxygen in it, and because it has a certain amount of oxygen in that blood, that oxygen has a pressure. right? And then the deoxygenated blood, it also has a tiny bit of oxygen in it, and it has a pressure as well, but that pressure is going to be like lower, right? So there's oxygen has a pressure in your oxygenated blood. It has a pressure in your deoxygenated blood, and the numbers here are about 140. So oxygenated blood has a pressure of about 100 millimeters of mercury. Deoxygenated blood has a pressure of about 40. So it just goes back between 100 and 40. As that deoxygenated blood is going to your lungs and getting oxygenated, it goes back up to 100, roughly. As that blood, that oxygenated blood, goes to all your cells to oxygenate your cells, the pressure in your blood drops down to 40 again. Goes past your lungs, goes back up to 100. Goes to your cells, drops back down to 40. Those are your two numbers. So yes, know those numbers. They're not exact, but have an idea. The pressures for carbon dioxide are a little different. In deoxygenated blood, it's going to be about 45, and then as that goes by the lungs, the carbon dioxide's moving out of the blood, so that number's dropping down to 40. So it's a very small difference, 40 and 45, right? So just remember, carbon dioxide is going to be higher in deoxygenated blood and lower in oxygenated. And your two numbers to remember are 40 and 45. So 45 is in deoxygenated, 40 is in oxygenated. When you're talking about oxygen, the two numbers to remember are 140. So where's oxygen going to be higher? Which one's the higher number? The oxygenated blood, right? So oxygenated blood's 100, deoxygenated blood is 40. And that's kind of what this is all showing you here. So you've got like 4 different numbers I'd like you to know. What's the pressure? And what else? Yeah, why not? You should know the outside. So the pressure outside depends on elevation, right? So at sea level, we'll call it 160, 159, 160. So gases always go from higher to lower pressure. I mean, that's what this slide is about. So the pressure of oxygen outside in this ambient air is about 159. Inside our lungs, it's about 100. So the air wants to go from the higher pressure to the lower pressure, right? And then once it's in our blood, it's 100. But our cells is what? 40. So it goes from the 100 to 40. It's always going from higher number to a lower number. That's how oxygen moves. Carbon dioxide is doing the same thing, just in the opposite direction. So this is Henry's law. So Henry's law is saying that the amount of oxygen that will dissolve in blood depends on the pressure of the oxygen, and it depends on the solubility of the blood. This is talking about the pressure of the oxygen. Right? So at sea level, the pressure is 159 millimeters of mercury. As an example, I'm just giving you an example here. At 10,000 feet, it's 110. So the air is not thinner. It's not that there's less oxygen at the top of a mountain. It's just that the pressure of that oxygen is less. So what's the pressure of oxygen in your lungs? It's like 100. What's the pressure at sea level in New Orleans? It's 159. So that's a bigger difference, right? But when you're in like Leadville, Colorado, at 10,000 feet, now you're talking about a difference between 110 and like 100. So not as much oxygen is going to be moving across. That's Henry's law, right? And then, I mentioned the surface area available here because, so that's one of the symptoms of COPD. Less of your surface area is available. So you're breathing in oxygen, you're breathing oxygen back out. It can't move across that respiratory membrane. This is the other part of it. So there's two parts of Henry's law. The first part is the pressure of the gas. So the higher the pressure of the gas, the more it can move across the respiratory membrane, right? But the second part is how much of that oxygen, once it gets into your blood, how much will stick to your hemoglobin, like stick to your red blood cells, right? And so there's different factors. This is a question as well, right? So there's different factors that, well, as your the first two are things that you are things that you don't want to happen, and your body doesn't want it to happen, right? You don't want your body to be have a lower pH. But if your blood's a little bit acidic, that's what's going to happen. The oxygen's not going to stick to the hemoglobin, and then you're not going to be able to deliver oxygen throughout your body, right? So, and that's what acidosis is. I mean, that's part of it. In fact, what you're going to do if your body is like acidotic is that you're going to start breathing out more because your carbon dioxide is like acid. So you start expelling carbon dioxide to try to raise your pH and make your blood less acidic. But anyway, pH is one factor. Second factor is carbon dioxide, because carbon dioxide will, if there's too much carbon dioxide in your body, like you're not getting rid of it enough, it's going to start riding on hemoglobin. So it starts taking up the spaces that oxygen is supposed to use. The next two down here, heat and BPG, this is your body doing this on purpose. Heat, like fever, right? So a higher heat makes the affinity means to like. So it makes the how much oxygen likes hemoglobin, it makes it go down, meaning that it doesn't let hemoglobin stick to oxygen. In that case, it's good because you're trying to get oxygen off of your red blood cells and you want them to go to tissues. So, when you're ill, you need oxygen to start going. You need more oxygen to start going to all the tissues in your body to fight things and repair things and to make ATP. So in that case, you want it. And then this biphosphoglycerol, which you can just call it BPG. So if you remember back to the hormones where we had like thyroid hormones and human growth hormone and steroids, and I was asking what do they all have in common, and the answer was they free up energy to make ATP. This is also, so all these hormones release something called BPG, and that's going to cause oxygen to get released from hemoglobin with the purpose of going to your tissues to make repairs or to grow or whatever. So these are the four factors affecting how much oxygen likes hemoglobin. In other words, the affinity of oxygen to hemoglobin. What I want you to know here is that you just need to know the last one. Most carbon dioxide, so I might just ask you, how is carbon dioxide transported? So most of it forms by bicarbonate ions. I don't need you to know the formula, it's okay. I was just trying to show you here that here's carbon dioxide, it's attaching to water. And then when it does that, it forms, what do they call it, carbonic acid, right? And then I've got it balanced over here. So I've got HCO3 negative. Actually, you should, just as a little side thing, you should know that that's bicarbonate. Right, so it forms bicarbonate ions, and then it dissociates later on in your body, like at the lungs. Like by the lungs, they break back apart, and the carbon dioxide goes its own way. So most of it is bicarbonate ions. So I might ask you that. I'm probably most likely going to ask you that. I might ask you like something about like why is the air thin in the mountains? Like what is it? Is it really thin? You know, why is it harder to breathe in the mountains? So you should be able to say what it is. It's the pressure that's lower. So I might ask you that. There's a good chance I'm going to ask you about the partial pressures, and I forgot to tell you that because each gas has its own pressure. So that's why you see, if you look on this slide, you see it'll say like PO2 and PCO2. That means the pressure of oxygen by itself, partial pressure. So I might ask you, what are the partial pressures of oxygen and carbon dioxide? I want you to know what they are in oxygenated blood and deoxygenated blood. Lung volumes and capacities. Definitely, tidal volume. I want you to know a number for that one. That's the only one I want you to know a number for. Tidal volume. But I want you to know what minute ventilation is. And I want you to know what inspiratory reserve is and what is expiratory reserve. Remember, it's the maximum amount you can breathe in after a normal breath, maximum amount you can breathe out after a normal breath. What causes you to breathe in? Right there. Explain it. Don't copy what I'm putting. Explain it. Pretend you're explaining it to somebody that has no idea how you're breathing in. Like, what is it? So I want you to talk about it. You know, the diaphragm contracts, that increases the volume of the thorax, so it makes your lungs get bigger. When your diaphragm flattens, your lungs aren't attached to the diaphragm, but it's like pulling on it. So when your diaphragm flattens down, it's pulling on the lungs and making it larger. So that's causing the pressure in your lungs to drop to a point lower than the air outside, ambient air. All right, so I want you to be able to explain it. What causes us to breathe out? I might roll that into the same question. So I'm going to put that on there. So what causes us to breathe out? It's just elastic recoil. You mentioned the external intercostals because that's costal breathing or shallow breathing. So that is a factor in us breathing in. That is a factor in your lungs getting large. Often I will ask what law pertains to this. Remember, because we had 3 laws, right? So which law has to do with this? Boyle's law. And that's it. Respiratory membrane. I might ask you what septal cells are. And there we go. There's your questions, right? So if you know that, you should be in good shape. All right, let me know if you have any questions. I'm going to stop recording. So don't forget your questions from the lymphatic system / immunity.